The research that we conduct in my laboratory has both basic and applied components. The basic component is primarily the fact that we are interested in the physiology of certain type of bacteria, and the applied component is that these bacteria that we work with are pathogenic in that they are able to cause disease in humans and animals. Basically interested in bacteria that cause what we refer to as opportunistic infections in cystic fibrosis patients. Cystic fibrosis patients are compromised. They do not have the ability to fight off bacterial infections that a normal healthy adult would have. And in fact, these are children when they actually contract the infections. And so the bacteria that set up these infections do so because they have different chemical and physical properties that we refer to as virulence factors. So one of the things we are interested in is studying the virulence factors produced by bacteria that cause infections in cystic fibrosis patients. Another thing that we're interested in is molecules, chemicals that are able to kill these bacteria, and we're interested basically in two facets. One, we're interested in how these molecules, which we refer to collectively as antimicrobial agents, we're interested in how these antimicrobial or antibacterial agents are able to enter the cell, and in situations where they are unable to enter the cell, we were interested in those mechanisms as well. These would be referred to collectively as mechanisms of resistance. One molecule is actually an antibiotic called daptomycin, and we have come up with a chemical procedure that allows us to extend the spectrum of this molecule. Normally it's only effective for a small group of bacteria, but we're able to administer this compound in the laboratory with other chemicals that allow it then to become effective against other bacteria. Another molecule we're interested in is one that practically everyone knows about. It's called triclosan. It's not produced by a microorganism, so technically it's not an antibiotic. Triclosan is a very broad spectrum. It's effective against almost all bacteria. We're very excited about our work, and we're overall just interested in learning more about the biology of disease-causing bacteria and coming up with novel ways to kill them.